Red light and near-infrared light therapy are getting a lot of attention. But when it comes to prostate cancer, where does it actually fit? And does it even make sense to use? Hi, I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative oncologist. Red light therapy is not a conventional therapy for treating cancer, but it is a therapy that I like to use and can be supportive along with other conventional therapeutics in helping patients with prostate cancer. Red and near-infrared light therapy is a certain wavelength. So it's different wavelengths of laser light or LED light make different colors. But also there's different wavelengths that actually have biological reactions on the body. Like with red near-infrared light, it's very potent on decreasing inflammation and modulating inflammatory cytokines. So to understand this is every substance on this planet absorbs or refracts light. So therapies that absorb red light, like let's see if you give a photosensitizing agent like methylene blue, that substance can concentrate itself in a cell, a normal cell or a cancer cell, and you can irradiate that with red light and it increases more power in there, which can make your cells more stimulated and work more effectively and get the mitochondria inside your cell working how it should and making more energy production so it's able to regenerate and be effective and do what it's supposed to do more effectively, which is what red light's really good at. But regarding cancer, what I love to use it for is using it with methylene blue, because that's what red light gets photosensitized in the methylene blue. So the methylene blue goes in the cancer cell, we can irradiate it with red light, and then that can really concentrate that power of red light inside the cell, and it can make a burning reaction or a destruction of the cancer cell when we do that. So red light is great for prostate cancer for multiple different reasons. Most cancer is related to a chronic inflammatory response, which then dysregulates the immune system, making the immune system weak. We are always forming cancer cells all the time. But the big thing is our immune system detects these mutated cells and gobbles them up. But when cancer actually starts to take residence and you actually get the diagnosis of prostate cancer, it is when the mutations are happening faster than the immune system's able to take care of it. With red near-infrared light, we're able to decrease that inflammatory response, which then will improve the immunological function through improving that inflammatory milieu. Also, inflammation is what is going to help the cancer grow. It wants this inflammatory response. So if we decrease that inflammatory response, it's going to decrease the growth. So it's really cool that way is we're able to actually improve bodily functions with red near-infrared light, which is very important because we want your body working optimally so it's able to fight the cancer cells off itself, but also it's actually having some anti-cancer action. So some of the limitations that go along with red light and prostate cancer is I talked about some of the things is like, I don't personally use red near-infrared light alone without like a photosensitizing agent. I talked about methylene blue, or you could do nano ICG, which is another product that can be used to photosensitize and kill cancer cells. That's what I do. I always use a photosensitizing agent to have the most effect. I don't use it alone because it's not going to have that real good killing effect of killing cancer cells. Now it's going to have the anti-inflammatory, improve your cellular functions. But to think that you're just going to use red light and you're going to kill cancer cells, it's not probably going to happen. Now, a limitation too is it's only a piece to the puzzle. It's not that you only use red near-infrared light. You use that with all of these other therapeutics that we are going to be talking about or we've already talked about today. Red near-infrared light is a piece to the treatment. It's not the sole treatment. Yeah, so red near-infrared light makes sense for someone if they are looking for a therapy to improve their cellular function. Someone that is wanting their mitochondria to work more effectively, wanting to decrease that inflammatory response. Maybe you absolutely don't know if you do need that or not, and that's why integrative oncologist is going to know what you need to do there too. I'm Dr. Jake Schmutz, a naturopathic medical doctor and integrative oncologist. If you think that I am a good fit for helping you with your care, click the link below and schedule a consultation today.